This digi explanation is going to explore the use of stem cells in medical therapies. Here we have our learning intention, and students will be able to explain how stem cells can be used to limit lung damage in babies. In addition to the definition of stem cells above, stem cells are also characterized by their properties of self-renewal and potency. Introducing now is Dr. Sharon Fleckner, who will be talking about what her team has been doing in the past and into the future.
At this point, if babies are born very prematurely, they may be 26 weeks of a 40-week gestation period, their little tiny alveoli, or their gas exchanging areas, are not yet fully developed. So what we have, or what doctors currently do, if a woman comes into the hospital and she's at risk of preterm delivery, they'll give them corticosteroids. And those corticosteroids are meant to try and help the lungs mature, but they don't really do a very good job. And either way, the baby's still going to end up on a ventilator. And we know the ventilator causes this damage and then halts future development. So the question that we were trying to ask is, how can we go about trying to help these preterm infants? Is there anything that we can do to try and either decrease the damage or to help them continue to develop their lungs after they're born?
So how could stem cell therapy assist in combating this lung damage which is found in infants? Sharon will explain.
So what we were looking at, the team that I was working in, we're using preterm sheep. Sheep have a really similar lung development to humans, and they're also a similar size, so we can put them on a neonatal ventilator similar to what you'd use in a hospital. What we then did was we actually injected those preterm sheep with human amniotic epithelial cells. So these are pluripotent stem cells that are derived from the amnion being the membrane that surrounds the amniotic fluid in the pregnant woman. So the pregnant woman delivers her baby, and left behind are a whole heap of membranes in the placenta. And they're normally just discarded.
So stem cells can be classified into three different types, that is totipotent, pluripotent, and multipotent. Now, pluripotent stem cells can give rise to any cells of the body, except extra embryonic cells such as placenta and chorion. And an example of this is embryonic stem cells. Contrastly, multipotent stem cells can give rise to only a limited number of stem cells and related to their tissue or origin. These multipotent adult stem cells can only differentiate into a limited number of cell types such as bone marrow stem cells, epithelial stem cells, and bone stem cells. As discussed previously by Sharon, her research team was making use of embryonic stem cells in her research.
So what the doctors do is they go in, or the scientists, they go in and they collect some of the amniotic tissue. They isolate the amniotic epithelial cells, and then they grow them in a dish. And those cells that are grown in a dish are then injected into, or in our case, were injected into our preterm lambs. We injected the amniotic epithelial cells into the preterm lamb, derived from a human, but now going into a lamb. And then we ventilated them using exactly the same things as we'd done with our controls. And what we found was 10 days later, they continued to have lung development, whereas our controls didn't, suggesting that the human amniotic epithelial cells were doing something which allowed the development to still continue. And in fact, when we looked at inflammatory markers, so there's a number of factors that signal inflammation in our bodies, when we looked at those markers, we found that they were decreased, suggesting that those stem cells were somehow able to decrease the inflammation and allow normal lung development to take place.
Sharon will now explain if there are any technical difficulties associated with her research.
We're really lucky with these human amniotic epithelial cells that they have a really low antigenicity. So that means they don't really spark a very good immune response in whatever you put them into. So we didn't have any real big complications.
So following this research information, if amniotic stem cells are normally discarded, as stated by Dr. Sharon Fleckner, would that eliminate any potential ethical issues? Please discuss with your classmates now.